This video is intended to demonstrate the steps involved in evaluating an embalmed cadaver's lung for pathology. It is intended to accompany the Cadaver's Lung PG laboratory guide. After removing the lungs from the cadaver in which you have dissected, be sure to ask your faculty whether it is okay to section the lungs before proceeding with this evaluation. First, examine the surface of the lung for pleural plaques, calcification, and evidence of tumors. Here, you can see several pleural plaques depicted on the surface of this lung. Next, cut the lung along its long axis using a long, sharp knife. This type of cut allows you to examine all lobes of the lung and both the central and peripheral regions of the organ. The parenchyma of this lung looks normal. It is necessary to feel the lung tissue with your hands to palpate for hard lesions and increased density of the tissue. These characteristics are signs of pathologic processes. Refer to the laboratory guide to interpret these findings and learn about their clinical significance. Lividity is a normal characteristic of an embalmed cadaveric lung. It's accumulation of blood and fluid that occurs during the death process. This fluid accumulation accounts for the color differences between lungs. Sometimes you will see holes or widened spaces within the lung parenchyma. This finding is a characteristic of emphysema. See the laboratory guide for more examples and some background information on this condition. Here, you can see the lung with emphysema on the left alongside the normal parenchyma on the right. Sometimes you will notice bronchi that have thickened walls and white obstructive mucus inside the lumen. These characteristics are signs of chronic bronchitis, another type of chronic obstructive lung disease. This lung has a few small, hard lesions within the parenchyma. These lesions are oftentimes indicative of a neoplasm, or tumor. These tumors can occur primarily in the lung itself, called a primary tumor, or from cells that originate in other organs. This is called a metastatic tumor. Sometimes you will palpate firm lung tissue without the presence of any hard lesions. This is often a sign of pneumonia. Visually, the air spaces of the lung appear dense or filled in.